all of you for being here. Today's Dips for Dollars event is an outcome of community, intentional collaboration, and partnership. So last fall, Lieutenant Commander Tracy Murray, who you'll all meet shortly, invited the HBCU Cares team to a meeting with other behavioral health equity stakeholders. And so in this space, we were invited to connect, brainstorm, and share. And we learned quite a bit from each other. And because of that, one meeting led to two, and so on. And at some point, we were asked to dream of ways that we could use our collective capital to make a difference. And when we asked what we dreamed of doing, I want you to know that you, today's audience, is what came to mind for all of us. And so we wondered, what is it that students and practitioners are needing? So we asked, and many of you told us funding. And so then we wondered, well, how could we help amplify the many funding opportunities that are already out there for behavioral health practitioners? We thought about how we might share the cultural capital tied to those opportunities. And we wondered how we could streamline this very valuable information in one place, in one way. And so it's from those dreams and questions and dialogue that today's event was born. What's more, when we reached out to various organizations represented here today about joining in the stream, we received a resounding yes. And so we are so excited to see and hear from all of you today. We appreciate our presenters being here. And so before we get started, I wanted to share just a few housekeeping items. One is to help everyone focus on our amazing speakers. We're going to ask everyone else to keep their camera off unless they're speaking. We're also just a reminder to keep your audio on mute to minimize any disruptions. And just like you've already started posting in the chat, we want you to continue posting your questions and comments in the chat box throughout today's event. Again, we are so glad you have chosen to join us today, to spend time with us today. I hope you learn and make many connections. We will now have remarks from Lieutenant Commander Tracy Murray, the SAMHSA Assistant Regional Administrator for Region 6, and our fierce Partnerships for Equity leader. This event would not have come together without her advocacy, commitment, and care. Lieutenant Commander Murray, the virtual stage is now yours.
Thank you so much, Dr. Johnson. I appreciate your leadership in this activity, this event as well. So I just want to share with you all a bit about the Partnerships for Equity initiative overall. And so this initiative aims to achieve behavioral health equity for all under-resourced groups by building diverse, sustainable partnerships that maximize resources. What you see in the team that we have built in this PE group for African American behavioral health equity is that everyone brought something to the table, but we're all gaining, we're giving and we're gaining in this space, right? There are so many resources that we each have that we brought to the table, which made this event, this project, so much better as a team. And so the four main objectives of the PE initiative, they are around measurable impact, like today's event, how we can capture the HBCUs that we're connected with, but the diverse community period that we are reaching, that there are diverse voices, even within our team, that there are some staff that work at SAMHSA, but there are also external partners in our PE groups. And then awareness, how we can raise awareness about behavioral health equity issues and awareness about the activities that we are doing. And then together, all of these PE groups represent a powerful framework in how we can have stronger, more effective public and private partnerships, how we can work together with federal and non-federal partners. This here is just a glimpse of some of the PE groups that are currently online now. So certainly you see what we are doing in the PE group for African Americans with this Dips for Dollars webinar series. But in light of all the work we've done in that PE group, we've also had a needs assessment of HBCU behavioral health students and their financial barriers. And taking the opportunity to use some of the feedback from that needs assessment to make policy recommendations for funders. We also have a PE group for Hispanic and Latino behavioral health equity. And that group's project is to create a learning community surrounding stigma issues and supporting workforce development. There are 3 target audiences for that learning community. That would be community health workers or promotores de salud, looking at ways that we can support Hispanic student-led organizations and helping them in building stigma awareness campaigns on their campus. And then also ways that we can support the criminal justice system and the stigma surrounding Hispanic Latinos who are involved in the criminal justice system. Lastly, the newest PE group that has come online is to support American Indian and Alaska Native behavioral health equity. And this group is in discussion around what their project would be. And some ideas are around mentorship programs, early pathways into the behavioral health field, and also ways that we can partner with our federal partner, right, Indian Health Service, and creating opportunities for students to engage and be exposed to the behavioral health field in that way. So I'm so excited to be involved in this work, to lead this work, and I'm quite thankful for all of the partners who are involved in each of these different groups. And so we will now have remarks from Dr. Mary Worry, who's the director of SAMHSA's Office of Behavioral Health Equity and a key partner and supporter of the Partnerships for Equity initiative. Following Dr. Rory's remarks, my colleague and my good friend Taylor Bryan Turner, SAMHSA's Assistant Regional Administrator for HHS Region 1, will give us an overview of her DIPS model, which we adapted for this event. Dr. Rory?
Thank you. Good afternoon, everyone. Here we go. So, can you all hear me? Can I get a thumbs up or a yes? Very good. Thank you. Because someone cared enough about us, we are all here. Moreover, we are here because of the Biden-Harris administration executive orders. Executive Order 14041, White House Initiative on Advancing Educational Equity, Excellence, and Economic Opportunity through Historically Black Colleges. Executive Order 14045, White House Initiative on Advancing Educational Equity, Excellence, and Economic Opportunity for Hispanics. Executive Order 14049, White House Initiative on Advancing Educational Equity, Excellence, Economic Opportunity for Native Americans and Strengthening Tribal Colleges and Universities. I could go on. We are all here because creating a diverse world of leaders required current leaders to keep the pathway flooded with more diverse leaders. Welcome all. We are all over the moon that you have joined us here today. We're hoping not only to replicate this event in Asian Americans and Native American Pacific Islander serving institutions, Alaska Native, Native Hawaiian serving institutions, Hispanic serving institutions, predominant Black institutions, tribal colleges, universities. Wait for it, hold your breath. We're going to try to do this at least yearly. I would like to give a special shout out to the entire planning team and a special thanks to our bodacious brainchild behind the event, Dr. Tracy Mary, who has worked tirelessly to make sure that we all stay on track. Look up perseverance in the dictionary and you will see Dr. Mary's name. I leave you with my favorite quote. In order to succeed, your desire for success should be greater than your fear of failure. I leave you with a call of action. I want you all to replicate what you see here and learn here today because you are sitting near or across from another leader. Dr. Taylor Barrett, you're up.
Incredible. Thank you very much, Dr. Rory. I'm so grateful for your mentorship and for being a force for my and Dr. Murray's initiatives at SAMHSA. Welcome everybody again to the first Dips for Dollars event. This program continues to evolve and it's such a gift to be part of the Partnership for Equity family. My name is Taylor Bryan Turner. I am the Assistant Regional Administrator for SAMHSA in the New England region. The difference is it's 32 degrees here today. And it's an honor to have this role alongside Dr. Murray. I've been asked to share how the Diversity Inclusion Project Showcase came to be. So let's dive right in. When I started at SAMHSA, right at the top of the pandemic, it was immediately brought to my attention that Black and Brown CBOs in the trenches, working in behavioral health, social determinants of health, substance use disorders, where people of color were dying quickly from COVID-19, right? Those organizations were underfunded, unseen, unheard, completely missing from funding rounds. And I wanted to do something about that. So I wanted to know what SAMHSA could do. Well, first we can own it, right? We can do better. We can work with OB and Dr. Rory's team to elevate CBOs. We can ask to see where the money is going, and we can convene. We can expose these organizations to potential funders, amplify their presence, highlight their body of work, their population served, and celebrate the strong impacts being made in community across the country. So let's talk about the vision. Next slide, please. The mission is to create a safe space to cultivate strong partnerships for equitable and healthier communities, right? We're doing that today. The goal is to provide diverse nonprofit organizations an opportunity to present their business focus, their populations, and their impact to regional behavioral health leadership. The purpose is an intentional effort in direct response to what our community members need, what they ask for, which is to gain access to funding. SAMHSA is exempt. I'm not sure if you know this, but SAMHSA is exempt from advising states on how to allocate federal funds. But as a convener, right, and having events like this, the DIPS for Dollars, encourages the assembly of historically marginalized populations and places them with visible and viable entities in an effort to build long-lasting sustainable relationships that lead to funding and opportunity. So DIPS is a showcase. It is a round-robin style of innovation coming at you to provide you with an opportunity, access, and hope, right? It dispels the notion that, oh, I didn't know about that agency, so that's why we didn't fund them. I didn't know about that opportunity, and that's why I didn't pursue it. So knowledge, right? We want to do that. There needs to be a front runner, a champion for diversity at these events, right? 2, we want to have people who are seeking opportunity. And 3, we want to have the people who can provide those opportunities along with success stories that can show you what a partnership and collaboration looks like, people with lived experience. And you'll hear plenty of all of that today. We are providing you with these entities that can help you nourish your goals in behavioral health. We have an outstanding agenda with incredible change makers and experienced professionals so that you can continue to thrive at your fullest potential. So DIPS is intended to be an in-person, in-community event. We've had to have them virtually for the last 2 years. Imagine how electric this would be in person. We've never had the chance, but we aspire. There are all different kind of categories that you can tailor DIPS to. And today's category is opportunity and resources. But you can focus on youth, women, LGBTQ, reentry, faith groups, and HBCUs. And really quickly, from a survey this month I want to read by the Student Affairs Administration in Higher Education, the Comforts Report, it states that while more than 60% of administrators said their colleges had made diversity, equity, and inclusion a priority, just 32% said they believed their institutions were adequately addressing racial justice, campus climate, and equity. And I feel that this work and the work of PE in a way is increasing our visibility to wider audiences and an opportunity to take care of ourselves as well as others. So kudos to all in support of events like this. As I wrap up, I'd just like to reiterate that DIPS is about building partnerships, networking, and being seen. So if you see an organization today that you like to work with, please reach out to them, slide into their a private message and introduce yourself and say, you know, your program inspired me. My auntie used to work there. I want to work there. Look out for an email from me. And this is my name and email address, right? Our brighter future depends on the steps that are taken after today. And like Dr. Maya Angelou said, do the best you can until you know better. And then when you know better, you do better. And it's an honor to be in the room with so many brilliant people. Thank you for your time to share my vision and for making it a reality today. Thank you.
Thank you so much for that, Taylor. And so now Clayvon Majid, one of our interns within SAMHSA's Office of Intergovernmental and External Affairs, will introduce our first speaker. Clayvon?
Thank you, Dr. Murray, and thank you, Taylor. Hello, everyone. I'm so happy to be here and provide the speaker intros to some of the speakers of today. First, I'll be introducing Mr. Matthew Lockhart, Acting Director of the National Institutes of Health's Loan Repayment Division. In this role, Mr. Lockhart is responsible for administering and providing leadership for the NIH loan repayment programs, or LRPs, as well as representing NIH on matters related to the operations, policy development, and evaluation of the LRPs. Prior to this position, Mr. Lockhart served as a program analyst, in DLR, and is the architect of several policy papers and analyses that assess the impacts of newly enacted legislation on the NIH LRPs. Before coming to NIH, Mr. Lockhart led the Veterinary Medicine Loan Repayment Program at the U.S. Department of Agriculture. Following his presentation, if time allows, Q&A will be moderated by Corey Ware from the African American Behavioral Health Center of Excellence. The floor is yours, Mr. Lockhart.
Perfect. Okay, thank you so much. Thank you again for having me here today. I'm really excited to talk about the program, and thank you for that nice introduction as well. You can go ahead and click the next slide. Thank you. Okay, so before I talk about our loan repayment program, I want to talk a little bit about NIH itself. If you guys are not familiar with NIH, the National Institutes of Health is one agency that is comprised of 27 different institutes and centers. Each institute and center has their own focus on bodily systems or disease areas. For example, we have the National Eye Institute, we have the National Heart, Lung, and Blood Institute. We also have the National Cancer Institute or the National Institute for Health. So as you get the point, all of those have their own allocations and as well as their own research funding priorities. All of this is to say that we do have one goal. And if you can click the next slide. That goal is to support the training and career development of biomedical research workforce. And the next slide, please. Okay, I'm sure you all are wondering how our program works. So all new LRP awardees are for 2 years. So that will require 2 years of commitment to your research once awarded. That 2-year commitment of research subs our funding of $50,000 per year to your educational loan debt, or $100,000 for that total of 2 years. Those payments are made on a quarterly schedule. And that loan repayment is considered taxable income. So we also do add an extra 39% of tax payments to the IRS to lessen that tax burden when you do receive that allocation. Once that 2 years is up, if you'd like to continue your research, you can apply for a renewal. You can do that for 1 or 2 years. There is no limit on the number of renewals that you can apply for, so you can apply as long as you want until you have no more educational debt. And all of that is, of course, our desire to really increase our nation's stock of biomedical research scientists. Okay, and next slide, please. Currently, I want to talk about our extramural program, but we also do have an intramural program as well for scientists who are doing research as employees internally here at the National Institutes of Health. The extramural program is for researchers who are conducting their research at any domestic nonprofit institution anywhere in the US. For the extramural program, we have 6 different categories that are shown here on the slide. Because the time is limited, I'm not going to go through each category, but you can find more information about each category on our website. Altogether, for those 6 categories, on average, we usually get about 2,500 to 2,600 applications every single year. Around 50% of those applications are awarded, so we have about a 50% success rate. Next slide, please. Okay, this is something that is important to know. How are you able to qualify and be eligible for this loan repayment program? So there are 5 different eligibility criteria that you must meet. The first one being that you must be a US citizen, a US national, or a permanent resident here in the US. The next one is that you must have a qualifying degree. Most of them require a doctoral degree, but there are some categories that are listed on the previous slide that will accept a master's degree. So for those exceptions, you can go ahead and contact us and we can tell you more. We do accept some credentials or certifications with master's degrees as well. Your educational loan debt altogether must be 20% of your annual income. For that research funding, it has to come from a domestic nonprofit entity or a US government agency. If it is federal, state, or local, those 3 do apply. You can take that from, excuse me, this is the interpreter. We had a bit of a frozen screen here. Okay, go ahead, I can see you now. Okay, perfect. The NIH grants, university income is considered eligible funding. Your work, of course, must be with a nonprofit institution, and you're not required for that NIH grant to be eligible, to have an NIH grant to be eligible, excuse me. The next thing is you have to do that qualifying research for at least 20 hours every week for that quarterly time that you are being funded. Next slide, please. Okay, like I mentioned earlier, the NIH is made up of 27 institutes and centers. 24 of those do participate in the extramural loan repayment program. When you do apply to this program, your application is going to be assigned to one of those 24 ICs for review and scoring. It is really important to be familiar which IC is the best match for you. You have the opportunity to pick up to 2 institutes or centers as your quote unquote primary IC. And then once you are assigned to that, you will be reviewed and scored and given feedback by whoever scores. And they will also let you know if you will be awarded or not. It's important to talk with the program officer. We have L.E.A.P program officers in each institute and center. So it's really important that you talk with the program officer before you apply, and you can find out just some important information. You can talk about your current research and your goals, and you can talk about that current IC's priorities as well to see if it's a match for you in the L.E.A.P program. The list that you see on this slide now has contact information for the program officers, and that's also available on our website as well. Okay, next slide, please. Okay, so when you do apply, of course, you want to make sure that you are writing a competitive application. So it's important that you know the funding priorities of the NIH. Of course, specifically for those ICs that are reviewing your application, like what is their mission and what are their research priorities. You have to effectively demonstrate your qualifications and make sure that you are committed to the research. And you can talk about yourself, who you are, what your priorities are, your scientific background, where you are right now in your career specifically. You can describe your short and long-term goals as well. It's important to do a thorough explanation of that to make sure that they get good context of who you are. You want to make sure that you have a strong research plan as well to present. Strong reference letters are important as well. You want to show what makes you unique to the other applicants and demonstrate your strengths and your commitment to the research career as well. You want to make sure how you can contribute to the NIH, and you want to be able to show that. And if you go to the next slide, all of the information that I had just given you is on NIH's website. Okay, so now, of course, like I mentioned, our website before has a plethora of information, and various good resources for applicants, or maybe people who are just interested in learning more about our program. I just want to point out a few specific things. On the top bar on the website where it's dark blue, you can see eligibility and for the program, and that's where you can find more information and details on those 6 categories for the extramural program that I had discussed, and you can see their eligibility criteria as well. We also do have an area on the website where you can find out more information about the 10-year history regarding our applicants, our awardees, the different levels that they've been able to achieve. And there's just so many different widgets that you will be able to play around and find more about the L.E.A.P program. Contact and engage, that's where you will find our list of L.E.A.P program officers that I had mentioned, where you can contact them and talk about the IC's priorities. And if you feel like it's a good match to your research, then you can go ahead and find their contact information on there as well. We also do have an L.E.A.P ambassador program. If you can click that, when you do go on the website and you click that middle bar there where it says ambassadors, you will be able to find a directory of over 800 former and current L.E.A.P awardees from all over the United States. You can contact them, and those ambassadors' contact information, you'll be able to see where they are. So you can contact someone in your specific area, and you can ask questions about their experience or how they like the program, maybe any tips to help fill out your application, or maybe how to make your application more interesting than others. Go ahead, next slide, please. Now, to wrap up the presentation, I just want to let you guys know that I am available for any questions. If we run out of time, I'm still going to be around to answer questions through the chat for a few more minutes. Here on this PowerPoint slide, you can see our contact information. This is for if you have any questions that come up after the presentation is done. We do have our website. We also do have social media as well, where we advertise different program successes. We have different announcements as well, where you can find more information. We also do have center staff that is available for any phone calls or emails for further questions. And that wraps up my presentation. Do we have time for questions?
Unfortunately, we don't have time for questions right now, but we do have a few in the chat box that you could answer. So we want to thank you for your time, Mr. Lockhart, and your presentation. I'll pass it over now to Ms. Lindsay Sims from the HBCU Cares team.
Thank you so much.
Thanks, Corey. I'm pleased to introduce our next speaker, Captain Tracy Galandi, a senior public health analyst at the Health Resources and Services Administration. Before she got into this position, she also worked in the Bureau of Prisons. Galandi is a graduate of Texas Women's University, where she earned her master's degree in 2001 and doctorate degree in 2010. Both of these degrees being in physical therapy. Ever since 2007, she has worked as a commissioned officer in the U.S. Public Health Service. Some highlights in her career include serving vulnerable populations and spreading the word about public health and wellness in the prison system. And she also has served as a national advisor in her areas of specialty. Now she works for the National Health Service Corps program and Texas State Lead, and also as a placement advisor for the National Corps and Service Corps scholarship recipients. Following her presentation, if time allows, Q&A will be moderated by Lysandra Purcell from SAMHSA's Office of Behavioral Health Equity. The floor is yours, Captain Galandi.
Thank you for that introduction. I am excited today to talk about the National Health Service Corps program. If we could go to the first slide. Next slide, please. As you can see, the National Health Service Corps is celebrating our 50th anniversary. For 50 years, the National Health Service Corps has built healthy communities by providing loan repayment and scholarships to clinicians willing to serve in underserved areas. And I'm going to talk about those programs today. Next slide. As you can see, we have several programs. We have a loan repayment program, our Students to Service program, our state loan repayment program, and our scholarship program. And as you can see, compared to the number of applications, we made a significant amount of awards this year. Next slide. Currently, we have nearly 20,000 NHSC members providing care to nearly 21 million people in the United States. In 2021, we awarded every eligible applicant, making this our largest class of clinicians ever. Many NHSC members continue to serve in our areas of greatest need beyond their service obligation. Next slide. The first program I'm going to talk about is our loan repayment program, our traditional loan repayment. Next slide. Our traditional loan repayment program provides up to $50,000 for a 2-year service commitment. It's awarded to clinicians that work at NHSC approved sites, and the following disciplines apply or qualify: physicians, mid-level providers such as nurse practitioners and PAs, our mental health and behavioral health providers such as our counselors, psychiatrists, and also dental providers. This isn't a full list of disciplines, so you would want to check out our website to see if your discipline would qualify. Sites are awarded a HPSA score. A HPSA score is a health professional shortage area score, and the higher the score, the higher the need. So our funds are awarded to the areas of the highest need first. Next slide, please. Next, I want to talk about our substance use disorder program. This is our we call it SUD, our substance use disorder workforce loan repayment program. Next slide. Oh, you can stay on that slide. I'm sorry, go back a slide. Thank you. Our SUD L.E.A.P program awards $75,000 for a 3-year service commitment, and the clinician must be trained and licensed to provide SUD treatment at an NHSC approved SUD site. Next slide. Next, we have our rural community loan repayment program. Our rural community loan repayment program awards up to $100,000 for a 3-year service commitment. You must be trained and licensed to provide SUD treatment at an NHSC approved rural SUD treatment facility. Next slide. We also have what's called our Students to Service Loan Repayment Program, or we call it S2S. Our S2S program is awarded to physicians, dentists, nurse practitioners, certified nurse midwives, and PAs. They apply during their final year of school, and they're awarded up to $120,000 of loan repayment for a 3-year full-time commitment. Next slide. Finally, we have our scholarship program. In our scholarship program, clinicians must be pursuing a degree in medicine, such as allopathic or osteopathic, or a degree in dentistry. They could also be working on a postgraduate degree from a school of nursing, such as an APRN, nurse practitioner. And as of last year, they allowed physician assistants and certified nurse midwives as well. Next slide. For our scholarship program, they pay for your tuition and fees. It's a minimum 2-year service commitment, and the number of years of support equals the number of years of service. For instance, if we pay for 4 years of medical school, then you would owe 4 years of service time to serve in an underserved area. And the difference with our scholarship program is that the program requires a minimum HPSA score requirement, and it is set by discipline and is updated and published annually. Next slide. I just want to next slide. I want to talk a little bit about our other programs as well. We discussed the ones on the left column. We also have what's called our Nurse Corps. Our Nurse Corps program makes a loan repayment and scholarship awards to RNs and APRNs. It's a different program than our National Health Service Corps program, and it has a different website, so you want to check out that as well. We also have what's called a Native Hawaiian Health Scholarship Program. We have a faculty loan repayment program. We also have scholarships for disadvantaged students and a nurse faculty loan repayment program. Next slide. And I know that we're running behind on the agenda, so if you would prefer me to answer questions via the chat and move on to the next speaker, I'd be happy to do so. But I'm going to also post the link to our National Service Corps website in the chat as well. There's a lot of information. And we got a woohoo from a Nurse Corps L.E.A.P recipient.
Thank you, Captain Galandi. Yes, please look in the chat box to see if there are any questions for you, and you can please answer them. I am now going to turn it over to Dr. Don Tyus from the African American Behavioral Health Center of Excellence for our Pause for the Partners Spotlight.
Good afternoon. It's such a pleasure to be here today and be a part of such an amazing planning committee. I'm Dr. Don Tyus with the African American Behavioral Health Center of Excellence located at Morehouse School of Medicine. Next slide, please. Next slide. The African American Behavioral Health Center of Excellence was funded in 2020, October 1, 2020, for 5 years by the Substance Abuse and Mental Health Services. We were funded to develop and disseminate training and technical assistance and provide resources to help healthcare practitioners eliminate behavioral health disparities within the large and diverse populations of African American. We are housed at the National Center for Primary Care at Morehouse School of Medicine in Atlanta, Georgia. Next slide, please. Why we were funded. The center was funded because there was a scarcity of culturally appropriate evidence-based interventions and approaches for working with African Americans and very insufficient dissemination of the resources that even exist. Also, there's a minimal workforce on the social determinants of health disparities, historical trauma, unconscious biases, and really ways of building cross-cultural respect and trust when working with African Americans. We were also funded because we found that there are systemic inequities that have blocked access and engagement in behavioral health services and support for African American clients. But primarily because of the urgent need for greater equity and effectiveness in behavioral health services for African American, we were founded, and this approach is deeply grounded in our center because we've been structured to mobilize the scholarship and the expertise of many African American behavioral health and equity distinguished voices here at Morehouse School of Medicine, as well in the behavioral health field, which will drive the other components of our grant. Next slide. The Center of Excellence takes a very highly collaborative public health approach toward cultural and practical transformations. We'll be looking at behavioral health systems, looking in developing intervention, treatment, and recovery support practices. We're looking at the systems of education, which is centered around training and technical assistance that will prepare the field for this work, this diverse work. We're also our targeted audience are the professional and non-professional workforce, and we continue to work to make sure that diversity, equity, and inclusion is within the behavioral health systems for African Americans. Next slide. The Center of Excellence, as you can see, when you're thinking about African American, there are a lot of systems that impede access. There are a lot of systems that impede diversity. And so we'll be looking at the banking system, looking at the health system. We focus on the determinants. We're looking at the criminal justice system. So yes, our work is cut out, but it's very worthwhile and needed work. Thank you. Next slide. Some of our upcoming activities, because one of the things that at the Center of Excellence we love to do is we really want community engagement. We want to work with African Americans to make sure that they're part of our building this system and making sure that we're putting the right people to help enhance the workforce. One of the things that I'm super proud of is will be coming up is our Young Professional Leadership Academy. This will be early fall, and we'll make sure that you go to our website, give us your contact information, and so you can get more information. But with the Young Professional Leadership Academy, we're looking for graduates who have graduated, in African American graduates who are young professionals in the space of behavioral health. We'll take them through a 6-month to a 12-month program where we're not only look at their professional leadership, but we'll also be working on their emotional and mental abilities as well as total wellness. So that's an amazing program that we're developing. So join our mailing list so that you can get more information. We're currently doing our millennial roundtables, and what that is that we're talking to millennials who are currently attending HBCUs to talk about what are some of their challenges when it comes to mental health. What are some of the programs? What level of support that they need? This will help us build and develop resources as well as put other programs together. The We Need Each Other initiative. One of the things at the African American Center of Excellence is we know that this work cannot be done alone. We'll be kicking off a We Need Each Other initiative, which will mean that we'll be going across the country, having listening sessions to talk about how can we create synergy with community partners, faith partners, other providing organizations, with the federal government, those banking systems. We need each other to make sure that we can push the needle forward. And then soon, Corey Ware, who you heard from earlier, he's our training and technical assistance coordinator. He'll be launching our behind the lens podcast. So be on the lookout for that as well. Next slide. Just like my partner in crime, one of our amazing partners who's on our planning committee, like Taylor Bryant, I always like to end with quotes. And one of the things here for the center is I like for my staff as well, no matter where we are and what presentation we give, we always want to be reminded that an individual has not started living until he can rise above the narrow confines of his broader individualistic concerns to the broader concerns of all humanity. And that is what our center is founded on. And it's not about the I, but it's about the people that we serve. And that's Martin Luther King Jr. Thank you for the opportunity to just share a little bit about the African American Behavioral Health Center of Excellence. This is my contact information as well as Corey's. Thank you. If you have questions, I'll be in the chat. Thank you. Quavion will introduce our next speaker.
Hello, everyone. Hope you all can hear and see me. Our next speaker will be Mr. Corey Ahady. Okay. Acting Chief of the Indian Health Service Loan Repayment Program. Mr. Ahady has worked in the loan repayment program since 1995. He is an enrolled member of the Kiowa tribe of Oklahoma. Correct me if I'm wrong. He loves his work and the impact the program has on the agency. Following his presentation, if time allows, Lysandra will moderate the Q&A. The floor is yours, Mr. Ahady.
Hello, can everyone hear me?
Yes.
Okay, great. Thank you for inviting me today. I'm very honored to be here. My name is Corey Ahady, and I'm a member of the Kiowa tribe of Oklahoma. Let's go ahead and get started here. Next slide, please. Okay, so our program started with the Indian Healthcare Improvement Act. The loan repayment program became part of that program, and we started in 1998. And the purpose of our program is to recruit and retain health professionals into the critical shortage areas to where they are needed the most. Next slide, please. So the loan repayment program, in order to qualify, if you are selected, you must be in a full-time clinical position at an Indian healthcare program, which is either an IHS facility, a tribally managed healthcare program, or an urban Indian healthcare organization. Our program awards up to $20,000 per year. And our initial contract is for 2 years. So the first 2-year contract could be up to $40,000 minus taxes. Our program is considered taxable income. The awards are, like I said earlier, are based on the staffing needs and the availability of funds. Now, once you complete your 2-year contract, you do have the option of extending in 1-year increments. Currently you can keep extending until you clear out your debt. Next slide, please. This is the breakdown of how our awards went in fiscal year 2021. You can see the behavioral health at the top of the list, and you can see all of the other awards that we've made. If you know anybody in any of the other health professions categories, please pass along our information. We would be happy if you did that. Next slide, please. And this is a breakdown of a category in the previous slide, which is called the other professions category. And this is a breakdown of all of the professions in that one budget category. Next slide, please. This is a breakdown of how our awards went last year in fiscal year 2021. So you can see, you know, where all of our facilities, where the Native American population is, and see, you know, where the funds are going, and you know, and it's also dependent on the application received. So you can see like the Navajo area, the Oklahoma area, the Alaska area. Those were all really big, you know, areas that received a lot of funding last year, along with some of the other areas as well. So we're looking for applicants in those areas that are not represented as well here. So please pay attention to those as well. Next slide, please. This is a breakdown of our awards by personnel system. As you can see, most of the people who were awarded in our program last year were tribal, direct hire tribal employees. We didn't have that many in the urban Indian healthcare organizations. And then the ones that work for federal facilities are represented by GS and CC, which are commissioned personnel officers. Next slide, please. This is a list of our health professions. Please pay special attention to the behavioral health section. You know, as far as behavioral health goes, you must be licensed, you know, in order to qualify for our program. But these are the professions that are eligible. We fund clinical psychology, counseling psychology, and social work. Next slide, please. Here's the rest of the professions that we fund. And, you know, just for your information, if you have any other colleagues that are health professionals in these areas, please let them know. Next slide, please. So our program, we accept applications all year round. This year, fiscal year 2022, we are just getting started. So if there are, you know, any health professionals ready to practice, you know, we encourage you to check out the link and apply for our program. The deadline for each monthly award cycle is the 15th of each month, and then the last award cycle that we will have for the fiscal year will occur. The last deadline, you know, will be in August. August 15th will be the deadline, and then we'll make awards at the end of August, and that will be our last award cycle for the fiscal year. Next slide, please. This is just a quick overview of the breach of contract. You know, some people you know, the program may not work out for them, and you know, these are you know, some of the things that you know will place you into breach of contract. Next slide, please. And here, we would just like to leave you with our contact information. We have a great team of analysts and that handle the application. In particular, if you are a behavioral health person, your representative would be Mr. Daniel Eckelhawk. And he would be able to assist you with giving you information, making sure your application is complete, and getting you in those award cycles. Next slide, please. And for more information, you know, this is our contact information. This is our website. I would just like to close out by saying we at the Indian Health Service would love to have your expertise, your knowledge, your professionalism, and, you know, most of all, your care. We would love to have you at the Indian Health Service. If you are interested in our program, please give us a call, please visit our website, and please apply. Once again, thank you very much for allowing me to introduce you to our program. Thank you.
Thank you, Mr. Ahadi. We do not have time for a Q&A session, but I think there is a question in the chat box that you can answer. Thank you again for your presentation, and Lindsay will introduce our next speaker.
Thank you, Lysandra, and hello again, everyone. Our next speaker is Miss Ashley Harrington from the Department of Education's Office of Federal Student Aid, where she works as a senior advisor to the Chief Operating Officer. Before she got into this role, she worked at the Center for Responsible Lending as a federal advocacy director and senior policy counsel. Some examples of her leading in advocacy include helping to shape fair lending and consumer protection reforms to address racial wealth disparities. And one grand issue that really focused and defined her portfolio was student debt reform. And she has also previously worked at the United Negro College Fund and the New York Governor's Office. And some topics that she has written about include how student debt affects Black borrowers. And she has also given testimony before the U.S. House of Representatives, and Financial Services Committee, and Small Business Committee. Harrington's education includes a Bachelor of Arts in Public Policy Analysis from UNC Chapel Hill, and then she got her JD from New York University School of Law, and this is what gives her the opportunity to practice law in New York. And following her presentation, if time allows, Taylor will moderate the Q&A. The floor is yours, Ms. Harrington.
Thank you so much, Lindsay, for that great introduction, and really excited to be here today. So thank you for the invitation. We will go ahead and get started since we're short on time. So I'm here to talk about the Public Service Loan Forgiveness Program, which is a really great program in general, but it's also a really great program right now. So for those of you who don't know, the Public Service Loan Forgiveness Program was created by Congress in 2007 with the simple premise of forgiving the remaining balance of federal direct student loans for borrowers who did 10 years of service in qualifying public service employment. So that is federal, state, or local or tribal government, or at qualifying nonprofits. And so we're going to talk a little bit more about that, but that is the basic premise of PSLF. And so on this chart, it kind of walks through what that means. Under basic PSLF rules, you had to make 120 qualifying payments. So that's 10 years worth of payments on federal direct loans. And we'll dig into each of these pieces in a little bit. While working for a qualifying employer, when you were applying for and receiving PSLF, and at the end, the amount forgiven is not taxable. So a little bit different than some of the other programs that are really great programs that are talked about today is, well, one, it's longer, it's 10 years of service. It doesn't matter what employment you're actually in, as long as you're with a qualifying employer, and it's for all direct federal student loan borrowers. Next slide. So what that means is, there are certain eligible loan types. That is direct loans. And so that includes direct consolidation loans and Parent Plus loans. Most of the people here, I think, probably have direct loans. Up until after 2010, that's all the federal government merely makes is direct loans. There are still some Perkins loans that were made through 2017. But prior to that, the biggest loan program was the Federal Family Education Loan Programs. These were loans that were guaranteed by the federal government, but not originated by the federal government. So they were originated by folks like Sallie Mae, or JP Morgan Chase, or big banks like that. And so we no longer have those loans, but the loans still exist because people are still in repayment. Post 2010, most loans are going to be direct loans. And so for PSLF, under normal rules, you had to have direct loans, including loans that were consolidated into the direct loan program and Parent Plus loans. It does not include FEL loans, the ones I just talked about, the federally guaranteed loans, the Perkins loans, which are loans that are originated by institutions, but guaranteed by the federal government, which we have not made since 2017, 2018. And it also does include other federal loans or private student loans. Next slide. So you also had to make 120 qualifying payments, 10 years worth of payments. And to be qualifying, a payment had to be on time while you were on a standard plan or an income-driven repayment plan, which there are 4. We won't talk about that much today, but I can send links around if you're wondering more about the different repayment plans available for federal student loans. It had to be for at least the amount due, and it could be non-consecutive. So when we say 10 years, it doesn't have to be 10 years in a row. It doesn't have to be even So it doesn't have to be all at once. You can do 60 payments and with only like 5 payments each year. Or you can do 119 payments and then take 5 years off and then do another payment at the end. It can be in any order or time period that you want. You just have to get to those 120 payments. And so payments that aren't included as qualifying payments for your 120 are payments that are more than 15 days late, payments that were made on a graduated, extended, or alternative repayment plan, payments that were for less than the amount due, or payments that were made when not required. I know some people on here are still in school. If your loans are currently on an in-school deferment, for instance, or if you just graduated and you're still in a grace period, during that period, you're not required to make payments. And so payments that were made during that time wouldn't count towards your qualifying repayments. The only exception is right now for most direct loan borrowers, as many of you know, we are in a payment pause where we don't have to make payments. You can get credit for PSLF during this time period as long as you were working for a qualifying employer during the payment pause. So even though we're not required to make payments right now, you can still get credit. Next slide. You can make multiple payments for 1 month. So if your payment is $100 for that month and you pay $50 one week and $50 the next, as long as you're within 15 days of the due date, because you've paid the full $100, that month will count. We do accept lump sum payments towards credit. So if you have, if you're in some of these programs like the ones talked about today or other programs that are available and they're giving you lump sum payments to make your student loan payments, you can count those payments if you make it all at once, but it's limited to 12 months or a year or until you have to recertify your income-driven repayment plan, which is something you do have to do every year. Next slide. So the biggest thing to know is eligible employment. It's full-time employment, so that's 30 hours a week or the equivalent for a government agency, as I mentioned, so that's federal, state, local, tribal, or military. It does include all 501c3 nonprofits. It does include some other nonprofits if they do a qualifying public service. And there's a long list of those. It includes things like emergency management, public health, early childhood education, and things like that. It does not include part-time work unless you have multiple part-time jobs, all at qualifying employers that add up to 30 hours a week or full-time. It doesn't include volunteer work. So if you're doing work and you're not getting paid, that does not count. It never includes work for-profit entities. So if your employer, the one that's on your W-2 and that pays you, is a for-profit, even if you're working in a nonprofit setting, it doesn't count. It also doesn't include labor unions. So the important thing to remember about PSLF eligible employment is that it's about the employer. It's not about what you do for them. We're not going to ask you what you do for that hospital, what you do for that school district. We just want to know who pays you and if your employer is a qualifying employer. Next slide. So again, all about the employer. You can have multiple jobs if it adds up to full time. It does include work for religious organizations if they are 501c3s. Next slide. There's also something called temporary expanded PSLF. We call it TEPSLF for short. And so it is a version of the normal PSLF program with one key difference, that if the only reason you're not qualifying for PSLF is because you were on the wrong repayment plan, you can then get credit towards TEPSLF and still work towards forgiveness. And so if you're on an extended or graduated plan, you can then get credit. Next slide. But the really big deal that's going on right now is something called the limited PSLF waiver. That is a waiver that we announced last year in October, and it will go through the end of October of this year. You may have noticed when I was talking about the regular PSLF and TPSLF rules, it's a little bit complicated in terms of which loans count, which payments count, even which employers count. So the Biden administration decided they want to take care of some of those pain points that people had experienced over the years when they were trying to access public service loan forgiveness, particularly right now when we've relied so much on our public service workers during this pandemic. And so we waived a number of rules. We didn't waive anything to do with employment, so employment stays the same. But for right now, we've waived the rules about what types of loans count, and what types of payments count. So normally only direct loans counted And while people who had those federally guaranteed loans, those FFEL loans or those Perkins loans, could have previously consolidated into the federal direct loan program and gotten credit, once they did that, they would lose all the credit they had garnered or would have garnered on that previous loan. And so for right now, under this limited waiver, that is not the case. Borrowers can now get credit for time spent in repayment on those federally guaranteed loans. So if you've had FFEL loans and you've already consolidated, or if you have them now and have yet to consolidate, you can do so before October 31st, 2022, and get credit towards public service loan forgiveness on those loans. This is a really big deal. It's going to help a lot of people and has gotten a lot of people to forgiveness or much closer to forgiveness than they've ever been before. 100,000 people since we've announced this waiver have now gotten PSLF forgiveness of up to, and it's over $6 billion. And it's only going to continue to grow. So, and it also is waiving the requirements that you had to make your payments in full or on time, because different servicers were doing different things. You could be off by 50 cents for a month and not get credit for that, not get credit for that month, depending on your servicer. Right now, as long as you are in active repayment status, you will get credit for those months. We're not looking at how much you paid, whether you paid it on time. Even if you were happen to be delinquent that month, if you missed the payment, you will get credit. As long as you weren't in deferment status, unless it's a military deferment, or forbearance, unless it's the current COVID forbearance, or in default, you can get credit for those months in repayment, as long as you also show that you had qualifying PSLF employment. So next slide. So basically, if you're a student loan borrower, you're going to fall into one of three groups. You might be a borrower who only has direct loan. If you don't know, you should go to studentaid.gov, log in, look at your account, and it will tell you what type of loans you have. If you only have direct loans, you want to make sure that you have at least one PSLF form, which is the form you use to certify employment, and I'll show you where you do that next, by October 31st, 2022. Have at least one form for a qualifying employer submitted. If you've already consolidated into the direct loan program, so you had FFEL loans before, or you had Perkins loans before and you've already consolidated, you want to make sure that you have PSLF forms submitted, employer forms submitted for the time period before consolidation, as long as it's after October 1st, 2007, because that's when the program started. Now, if you still have FFEL or Perkins loans, you want to go ahead and consolidate those. You can do that on studentaid.gov as well. And then you want to make sure you get at least one PSLF form submitted. Effectively, you're raising your hand and saying you're working towards PSLF and you want the waiver benefits, and you need to do all of that prior to October 31st, 2022. This is a time-limited waiver. I cannot stress this enough. And we want to make sure that everyone can benefit from this. Another thing I'll say is, if you have multiple loans from different time periods, so you have loans from 5 years ago, loans from 2 years ago, if you consolidate them together, you're going to get credit for the entire consolidation loan for that 5 years, as long as you also have the qualifying employment. So your consolidation loan is going to get the maximum amount of credit available for any of the underlying eligible loans. That's important to remember as well. If you have Parent Plus loans, it's slightly different. Right now, if your Parent Plus loan is what underlies a consolidation loan, you won't get extra credit for that. But if you have a Parent Plus loan and you consolidate it with an older student loan, you can then get credit for that entire consolidation loan with the Parent Plus because of the student loans. I know it's a little bit complicated. It's a lot to talk about in 10 minutes, but I'll have some resources to show you next, and you can also follow up with me afterwards. Next slide. So just a quick note that right now the PSLF servicer, so the folks you want to reach out to get information about your account in PSLF is Fed Loan Servicing. So if you've not already enrolled in PSLF, you will get transferred to them once you submit a form. Please note that they are leaving the system, and later this year, PSLF will get transferred to another servicer called Mohila. But in the meantime, right now it's still Fed Loan Servicing, and when that happens, everything will get switched to Mohila. You will not lose anything. Everything else will stay the same. It'll just go to Mohila, but right now it's still Fed Loan Servicing. We're strongly encouraging you to submit your form using the PSLF help tool, which we'll talk about next. And I think that's it for that one. Next slide. So to submit a PSLF form, which sometimes you may hear me say PSLF or others say PSLF form, you may also hear them say an ECF, which is an employer certification form, which is what it was called prior to 2 years ago when we made one big form. To do that, you want to go to studentaid.gov/PSLF, and you'll get to go to the help tool. You'll log in and it'll ask you something very important, because this is where you're going to certify your employment. It's going to ask you for the employer's federal employer identification number, the EIN. This is something that you want to get off of your W-2 or a pay stub, and you are going to need this for every employer that you're trying to certify. You're going to have to look up the name as well, but the most important thing you're going to need is that EIN. And that is how you're going to look up your employers in the system and generate a form that then you will print out, sign, get signed by the employer, and then submit. So you need that EIN. And again, it's going to be on your W-2 and on your pay stubs. And that's what we're talking about when the EIN and who your employer is going to determine whether you're with a qualifying employer for PSLF purposes. Next slide. So just a couple of resources that'll show you more information about the waiver. It has great FAQs and frequently asked questions that touch on a lot of important information. It's also where we keep the most up-to-date information about the waiver. For the help tool, you're going to go to studentaid.gov/PSLF. And for general PSLF information, you want to go to studentaid.gov/public service. And if there's a few minutes, I'm happy to take questions.
So invaluable, outstanding, Ms. Harrington. Thank you so much. Unfortunately, we do not have time for Q&A, but we really appreciate you sticking around to answer a question in the chat box. I saw Dr. Tyus posted one. Thank you again for your presentation. I will now turn it back over to Quayvon to introduce our last speakers. Thank you so much.
Thank you, Taylor. First, I'll be introducing Commander Sean Bennett. Commander Sean Bennett is a behavioral health clinical consultant with Immigrations and Customs Enforcement Health Service Corps Behavioral Health Unit and works out of the San Diego field office. Prior to joining the team, Commander Bennett served as the behavioral health team lead at Otay Mesa Detention Center in San Diego. His previous assignment was with the Indian Health Service headquarters in Rockville, Maryland, where he worked as a public health advisor in the Division of Behavioral Health. Commander Bennett holds a master's degree in social work addictions counseling from the University of Maryland and has worked extensively in areas of substance abuse, domestic violence, suicide prevention, and the treatment of trauma. Next, I'll be introducing Lieutenant Commander Kimberly Calvary. Lieutenant Commander Calvary is a licensed clinical social worker and certified addictions counselor. She has over 15 years of experience working with children, families, active duty, military, and incarcerated individuals as an agent of change, guidance, and support. Her professional life includes a commitment to serving the public health needs of Americans as a lieutenant commander in the Commissioned Corps of the United States Public Health Services. She currently serves as a supervisory behavioral health provider with the Department of Homeland Security's ICE Health Service Corps. Following the presentation, Dr. Murray will moderate the Q&A. The floor is yours.
Thank you. Thank you. We meet again, Quayvon. Thank you for that wonderful introduction. Next slide. So you can go back to the previous slide just to do a lead in real quick. It's great to be here. Wow, it's been an amazing journey listening to all of these wonderful presentations. Everybody will be on notice. I will be reaching out to you because it's so many wonderful resources on this presentation today. Thank you, Dr. Murray and others for pulling this together. So the mind is our business: diversity, equity, and inclusion, and why it matters in behavioral health. I'm here today with my colleague, Commander Calvary, and we're going to go over some stuff with you today that's going to be very, very important. I was particularly amazed at Dr. Tyus's presentation and talking about the African American Behavioral Health Center of Excellence. So let's get it started. Next slide, please. So the question is, today our discussion points are going to cover what is the state of Black American behavioral health? One second. Okay, yeah. What is the state of Black America? What is the state of behavioral health for Black Americans? How does bias impact health outcomes, and what role can we play to make a difference? Next slide, please. So we know that race matters. So I want you to focus on some of these stats that we have here, while I just kind of share some reflections that we all may be tracking on here these past several weeks to months. Many of you may have heard of the young lady who was a former beauty pageant, Miss USA, who tragically leapt to her death in New York City earlier this year. Likewise, many of you may be familiar with the actress Regina King and her young adult son, who unfortunately took his life. We know all too well about these things because they come to us on the big screen, or through social media, but all too often we don't know about those folks who suffer in silence. And so we're going to talk a little bit about how that happens. Suicide death rate for Black youth are continually to increase faster than any other general group of population. And we know that many African American people are diagnosed and some undiagnosed, and oftentimes lack access to the proper health care. And again, that's why I thought the presentation by Dr. Tyus is really spot on. I mean, that's the kind of resource that we want to continue to support and make known to other people. And even when Black people do have mental illnesses, they're more likely to be overlooked. And oftentimes they are incarcerated, where sometimes they still don't get the help that they need. Next slide, please. And again, like Dr. Tyus, I do like quotes, and it just so happened to be from the same person. But I want us to, I'm going to read this, but I want us to think about this as well. So when our dark days become dreary with low hovering clouds of despair, and nights become darker than 1,000 midnights, let us remember that there's a creative force in this universe working to pull down the gigantic mountains of evil, a power that is able to make a way to transform the dark yesterdays into bright tomorrows. And again, by Dr. Martin Luther King. But obviously, the team of individuals that are assembled here are part of that transformational team of resources that we need to bring together to impact these the behavioral health needs of African American people and minorities everywhere. And so one of the things that I want to point out is, if you look at the little graphic up in the corner, we talk about Blacks represent some little over 13% of the US population, and account for over 16% or 16% of that, which are identified as having mental health needs. And the total figure is somewhere in the neighborhood of 7 million, which comprises more than the population of 3 major United States cities. So clearly the need is great, and we have to make sure that the resources get to where the needs are. Next slide, please. Now, there has been progress, and that's the good news, right? From as recently as 2015 to today, there's been a stark increase in the number of folks, African Americans and other people of color, who are represented among the ranks of folks in the mental health field. Now, I won't tell you exactly when I graduated from the University of Maryland, but suffice it to say that when I did, in my master's program for social work, I could count the number of African Americans in general on one hand, and African American men in particular. And I oftentimes was the only one of my kind in that group. More recently, however, as I've joined the United States Public Health Service Corps and continued to advance my career, I've seen an increasing number of African Americans and and other people of diverse backgrounds represented in the ranks among those in this noble profession. Still, as evidenced by the work of Dr. Tyus and the African American Behavioral Health Center of Excellence, we have work to do, and work is being done, and that's great news. Next slide. So how do we do that? How do we start to bridge some of that gap? We see, and as we heard from many of the presenters today, that loan programs are being offered and extended to people who are going into public service in general, to include the fields of behavioral health. Myself and my colleagues are always recruiting and reaching out to prospective young folks who are going through school and looking to start their careers to pursue a career in behavioral health. So education and awareness is always very important. We've heard again that some of the policy changes that are taking place to ensure that we can reach the people that we need, making sure that those who do not have access to care have the resources that they need. One of the things that is of particular interest to me is behavioral health integration. That's a term that you may have heard before, but essentially what it means and why it's important for us today who are assembled here is that many of us are in a variety of allied health fields or direct practice health fields, whether that's a physician or a nurse or a doctor. But we need to make sure that even in those fields, the behavioral health representation is clear and connected so that people are not overlooked. We all know the statistics about when we have African American women, for instance, who present for medical issues, their symptoms are oftentimes overlooked and not necessarily addressed in a thorough way. So the behavioral health integration approaches help to make sure we bridge those gaps and do not overlook the total person that we're treating. And behavioral health is leading the way in that regard. Next slide. And again, you can see some of the resources here, just a small sample of resources to include those that we heard about here today. And I encourage you to visit, to take part in, or to explore the various resources that are available in this regard. So we're gonna pivot a little bit and I'm gonna pitch it over to my colleague, Lieutenant Commander Calvary, to tell you a little bit more about how we're gonna pitch to you going forward. Thank you.
Thank you, Commander Bennett. So who we are, the United States Public Health Service Commission Corps is also known as a Commission Corps, was established in 1889. Our motto is In Officio Salutis, which means in the service of health, and ties into our primary mission of protecting the American public's health. We are more than 6,000 officers strong, and we are led by the United States Surgeon General, Vice Admiral Vivek Murthy. Next slide, please. USPHS was established over 2 centuries ago by congressional mandate to provide care and medical treatment to curb the spread of diseases from merchant seamen and immigrants arriving from foreign ports of call. We are one of 8 uniformed services, but we have the distinction of being the only one dedicated to protect, promote, and advance the health and safety of our nation. Guided by our core values, our public health service professionals serve in 11 specialty categories that include physicians, dentists, veterinarians, dietitians, scientists, nurses, engineers, health services such as social workers, psychologists, environmental health specialists, therapists, and pharmacists. We are assigned to the Department of Health and Human Services or in other federal departments who share a common mission to provide essential health services to underserved and vulnerable populations or advancing practice, policy, or research. As America's health responders, Public Health Service Corps officers are the first in line to defend our nation's public health against threats large and small. Next slide, please. Next slide. So what we offer is a comprehensive package that will include benefits, that will include medical care and treatment, that includes the opportunity to work with a diverse team and sometimes out of your discipline. We encourage you all to visit usphs.gov for more information, or next slide. Next slide. Reach out to Commander Sean Bennett, who can give you more information. If you'd like to drop some questions in the chat, we're more than willing to answer them, or an email address, we're more than willing to contact you. Thank you.
Oh, thank you so much, Commander Bennett, Lieutenant Commander Calvary. Appreciate you sharing this valuable information, and appreciate you being willing to answer questions in the chat box for us. I will turn it over to Dr. Johnson to close us out with some final remarks.
Thank you so much, Lieutenant Commander Murray. Can we just take a moment to give our speakers a virtual round of applause? We could throw some comments in the chat. This was just wonderful information, and I'm so excited to hear about all the amazing funding opportunities that are out there for folks who, for behavioral health professionals and others who do so much to help take care of our communities. I also want to thank our Partnerships for Equity and Event Planning team, as well as our amazing audience. We appreciate your patience and also your willingness to pose questions in the chat. We want to get your feedback about this event. And so before you go, please please complete the event survey. We are sharing the QR code along with the link in the slide, and we'll also place the link in the chat. We want your feedback so that we can continue to think about sort of what are the programs that are meeting your needs. So please share that for us. And then finally, I hope that we will see you all tomorrow at 10 a.m. Eastern Time as we showcase SAMHSA's Minority Fellowship programs. In the same way that we've got wonderful information today, we have more amazing information tomorrow, and you can use the same Zoom link information for tomorrow. That is all that I have today. Again, thank you all for sharing your time and your talent with us. Thanks again to the PE team, and we will see everyone tomorrow. Thank you.